Bismillahirrahmanirrahim. Today we will talk about loop electrosurgical excision procedure, commonly known as LEEP. Before discussing LEEP in detail, let us talk about the methods of treatment of cervical intraepithelial neoplasia. The different treatment modalities include, first of all, the ablative methods like cryotherapy, electrocoagulation diathermy, cold coagulation, and laser vaporization. The excisional methods for the treatment of cervical intraepithelial neoplasia include large loop excision of the transformation zone and loop electrosurgical excisional procedure, also known as LEEP. What is LEEP? It is a procedure which uses a wire loop heated by electric current to remove the cells and tissues of the genital tract. It is used as a part of diagnosis and treatment of the abnormal or cancerous conditions of the female genital tract. What are the indications of LEEP? LEEP procedure is used to assist in the diagnosis or treatment of the different conditions like, first of all, the polyps, which are benign growths. Secondly, it is used in the treatment of genital warts, which may indicate infection with human papilloma virus, a risk factor for developing the cervical cancer. And thirdly, the LEEP procedure is used in case of diethylstilbestrol exposure in women whose mother took DES during pregnancy, as a DES exposure increases the risk of cancer of the reproductive system. What complications and risks are associated with the LEEP procedure? Some possible complications include, first of all, infection, bleeding, changes or scarring in the cervix from the removal of tissue, trouble getting pregnant, potential for preterm birth or having low birth weight baby. What factors interfere with the LEEP? Certain factors or conditions may interfere with the LEEP, and these factors include, first of all, menstruation, acute pelvic inflammatory disease, acute inflammation of the cervix. Can LEEP procedure get rid of HPV? The answer is no, but a LEEP can get rid of abnormal cells that form in response to HPV infection so that they never become the cervical cancer. Is LEEP considered surgery? The answer is yes. LEEP is a kind of surgery, but unlike the other types of the surgeries that involve the sharp instruments, LEEP uses electricity to cut and remove the tissue. Now we will explain the procedure of LEEP. The first very important step is the preparation of the patient before procedure. So prior to examination, a woman's medical record, including the gynecologic and dysplasia history, should be reviewed to make sure that there is legitimate indication for the procedure. Take well-informed consent from the patient along with explaining the whole procedure, its complications, its risks and indication. After positioning of the patient under good light, pick the right size speculum. Select the appropriate LEEP electrode. If the facility of colposcopy is there in the setup, then it's a good idea to do brief colposcopy in the patient to find the worrisome spots. And although we find the worrisome spot on the colposcopy, but during LEEP procedure, we excise the entire squamocolumnar junction. So the first important step of this procedure is the use of local anesthetic. Numb the cervix by mixing lidocaine with epinephrine. Next, the LEEP electrode and the whole equipment is made ready to use. The tip of the bar of the LEEP electrode goes inside the cervix and then it is rotated counterclockwise. So, in this way, the specimen is taken by using a wire loop heated by electric current, which remove cells and the tissues. Sometimes we use different type of the LEEP electrode when the shape of the cervical os is not regular, as in case of the multiparous woman. So here, the procedure of LEEP has been demonstrated, in which we get sufficient sample from the cervix involving the squamocolumnar junction. Make sure before starting taking the specimen that electricity is connected properly. So this size of the specimen is collected and is sent to lab for the histopathology. In the post-operative care of LEEP procedure, we ask the patient to wear a sanitary pad for any vaginal spotting or vaginal blood or dark brown discharge. this spotting or discharge is normal for 1 to 3 weeks after LEEP. And another advice is to avoid the strenuous activity for about 48 hours. So thank you so much. That was all about the LEEP procedure. Subscribe on Obs and Gynae. Allah Hafiz.